Good afternoon, everyone. This is Dr. Val Arkush. It is Friday, June the 5th, which is the end of week 13 of the coronavirus pandemic here in Montgomery County. For those of you who are regular watchers, you might notice look a little dark today. That's because the power is out where I am currently located in my home office. And so just want to thank my staff who brought me a hotspot so that we could actually get this briefing done today. So since our press release yesterday, we have had 84 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 7,369. These positive cases are a result of a positive test for the virus, not from an antibody test. 25 of these cases are from our long-term care facilities. 3 are from our Montgomery County Correctional Facility. 2 of those 3 involve inmates, and 1 involves a staff member. And 56 are from individuals in our community. These positive individuals are from 25 municipalities. 61 of our 62 Montgomery County municipalities are home to individuals with COVID-19. Today, the individuals range in age from 2 years old to 101 years old. And as always, you can check our county map at montpa.org/COVID-19 for updated geographic information. Today, we have 43 females and 41 males. 1 is known to be hospitalized, and we do not have information on the rest. I'm also saddened to confirm that 14 more Montgomery County residents have lost their lives to COVID-19, which brings us to 720 deaths confirmed positive from COVID-19. Today's deaths occurred between April the 16th and June the 4th. 3 of these individuals passed away in a hospital, 10 in a long-term care facility, and 1 in a private residence. They ranged in age from 60 years old to 103 years old. In total, we've had 385 females and 335 males lose their lives to COVID-19. For the self-reported racial breakdown as we have it, we have 17 Asian, 3 Asian Indian, 3 Asian Korean, 88 African American or Black, 247 white, and 362 unknown. In terms of probable deaths, and just as a reminder, these are individuals who have COVID-19 listed on their death certificate, but we don't have laboratory confirmation that they have the virus. We currently have 114 probable deaths. Added to our 720 confirmed deaths, that's a total of 834. And should we get laboratory confirmation of any of these probable cases, we will move them to the confirmed positive total. Our hospital bed situation continues. The most recent day that we have data is June the 2nd, but we had about 180 people hospitalized on that date, which is a continued slow decrease in the number of individuals hospitalized with COVID-19. About 25% of those individuals did require a ventilator. Our long-term care facility situation continues to improve. In total, since we started recording these cases, these self-reported cases, we now have 2,022 cases residents and 714 among staff. And again, as a reminder, not all of these individuals are considered or are residents of Montgomery County. And so these case numbers do not add up into our official number that I gave you at the top of this briefing. But we do and continue to keep a very close eye on what has been a quite challenging situation in our long-term care facilities. And although it is much improved, certain restrictions will remain in long-term care facilities as we move into the yellow phase. Primarily, these facilities will still not allow visitors because there's still a fair amount of virus in these facilities. Of our 720 confirmed positive deaths, 607 are from long-term care facility residents, and that is 84% of our total confirmed positive deaths. Our situation remains stable at the Montgomery County Correctional Facility. As we've been discussing, we did retest 716 individuals who had tested negative the first time that we did the testing. At this point, 90 inmates have tested positive and are in isolation and their direct contacts quarantined. All currently have remained stable. And we do have a number of tests still outstanding on the staff members of the correctional facility. We know that at least 5 have come back positive. But again, everyone is in a stable condition and the facility is continues to operate as normal. Moving on to community testing, just a reminder that our testing capacity is now such that any person who needs or wants to be tested for the COVID-19 virus is welcome to visit any of our county testing sites. These sites are no cost, do not require health care providers' orders, and will test people of any age. We have a walk-up site in Pottstown at our Office of Public Health, Pottstown Health Center at 364 King Street in Pottstown. Testing is available in Pottstown Monday through Friday from 11 a.m. until 1 p.m., weather permitting. You can register for an appointment by calling 610-970-2937, starting at 8:30 in the morning of the day that you'd like to be tested. The Norristown site is at the Delaware Valley Community Health Center. That's at 1401 DeKalb Street in Norristown. Testing is available there Monday through Friday from 11 until 1, weather permitting. This is also a walk-up site. To register for an appointment in Norristown, you can call 610-592-0680, starting at 8:30 in the morning of the day that you'd like to be tested. Our Montgomery County Community College site in Whitpain continues to see people in cars and test people in their cars. And for the dates between April 16th and June the 2nd, we've now tested 8,485 individuals. We've received results on 96% of those individuals, and 1,130 have tested positive. So for 39 days of testing, we are running at 14% positive, but that's overall across those 39 days. Tomorrow they will be open, and the appointments for Saturday will open at 8 a.m. tomorrow morning. Appointments can be made at moncopa.org/COVID-19 under the green County Testing Information button, or also beginning at 8 a.m. tomorrow morning, you can call 610-631-3000. Tomorrow, the site will be open from 10 to noon, 10 a.m. noon for testing, and they will be closed on Sunday for a safety stand down. As a reminder, both CVS and Rite Aid are offering no-cost testing at several different locations in Montgomery County to individuals who are 18 years or older. And you can see an updated list of those locations at moncopa.org/COVID-19 under the County Testing Information button by clicking on the Testing Sites map. So, I don't know if you need to be reminded about this, But today we entered into the yellow phase. Thanks to everybody's hard work and incredible sacrifice over these last 13 weeks, we are finally at yellow, which is a great step forward. And I just want to remind you that our goal is a responsible reopen. So you can see a nice graphic on your screen now that goes through the governor's rules for yellow. And just as a quick reminder, telework must continue where feasible. In-person operations must follow all business and building safety orders and guidelines. Childcare and summer camps may be open, but do have to follow specific guidance. As I mentioned earlier, there will still not be any visitation at long-term care facilities or other congregate care settings or at the correctional facility. Schools remain closed. The stay-at-home order has been lifted. And now gatherings of up to 25 people are possible. So we've gone from max of 10 to max of 25, which is a substantial increase under the circumstances. In-person retail is allowable. The preference is for curbside and delivery if that's possible. And in terms of in-person retail in the store, stores are allowed to have up to 50% of their capacity within the actual store itself, between customers and staff. Many things do still remain closed. Gyms, hair salons, nail salons, any kind of spas or other wellness type of centers continue to remain closed. Restaurants and bars do continue to be able to offer carryout and delivery, and in some locations, outdoor dining may be available. So that will depend on the configuration of the restaurant, if there's space, if the municipality will allow seating on the sidewalk, things like that. So check ahead before you would go, but there may be outdoor dining in some of our municipalities, although I guess tonight might not be the best night to do that given this pouring rain. I do want to announce that we are working on safely and responsibly opening some of our larger county parks. The county parks will remain closed this weekend. Our trails are still open, but the parks are going to remain closed this weekend, and we hope to have an update on our county parks next week. But I do have some good news, which is that beginning today, the Valley Forge National Historic Park is reopening, and that there will be access to all park grounds, roads, trails, and parking lots. However, they have, like many of us, had some storm damage. So just be prepared that maybe not every single road or trail is fully open. They are also allowing 2 restroom locations to reopen, one at Wayne's Woods parking lot and the other at the Wilson Road parking lot. Those are restroom locations. Those will be the only 2 that are open. However, they just want me to remind you that they will be closed periodically for cleaning, thorough cleaning. If you're looking for guidance on a responsible reopen, the County Department of Health and Human Services, together with our Commerce Department, has been collating guidance on reopening and operating with the coronavirus in our region. And remember, this is about learning to live with this virus, which is going to be with us for the foreseeable future. That guidance is online at macopa.org/COVID-19 under the green guidance button, which is at the very top of the page. I do have some updates from our court system. So as of June 1st, 2020, the courts have had a partial reopening with some minor changes. The court's hours of operations are now restored to 8:30 a.m. to 4:30 p.m. As noted in the Pennsylvania Supreme Court's order of April 28th, the courts are slowly reopening with an emphasis on providing court services utilizing the lowest court interaction level possible within constitutional mandates. So that could mean that there could still be some courts that are only allowing paper filings, and there could be some that are fully remote, some that are partially remote, or some that are fully in person, depending on the court. The court has also implemented safety directives to minimize the number of individuals required or permitted to be in court facilities. and to minimize the contact between those individuals once inside the facility. Each division of the Court of Common Pleas has developed a written protocol identifying the types of cases that will be processed, which level they will be serviced during the reconstitution time period in a phased approach, what extensions have been applied, and if waivers are needed. The court is focusing on those types of cases where there is a greater need. In general, all courts will limit their hearing days to the fewest possible per week. Multi-court facilities will have limited days so that only one court is in the court facility each day. And that would apply to our, for the most part, to our magisterial district justice offices, where we often have 2 or 3 courts in one location. Multi-court facility staff will work remotely where feasible on the days that they are not physically in the court facility. Multi-court facilities will work together so that the assigned assistant district attorney and public defender can stay in that court location for an entire week to minimize people having to move around. So that's a lot, but please visit moncopa.org and search on general and divisional protocols to find details on how each court is operating. For any employee or member of the public that must come to the court buildings, please be sure to practice safe distancing, good hygiene, and know that our buildings all are under an enhanced cleaning protocol to assist in minimizing risk. So as we move into that yellow phase, our focus will be on keeping the curve flat. So just a reminder in some of the steps that the county is taking to make sure that that curve stays flat. We have begun contact tracing now. We're now doing close to 50 tracings per day. I want to urge you to please cooperate with contact tracing. This is one of the most important next steps in terms of making sure that we don't slide back and potentially have to shut things back down again because our case numbers are rising and our hospitals are being overwhelmed. So the contact tracing is kept confidential. If you happen, that person will only be told that they've been exposed. They will not be told who exposed them. But this is a critical component to identifying cases and then containing those cases to prevent a widespread outbreak. We do have plans in place to identify and assist in any disease outbreaks or hotspots that may crop up around the county. Testing is now expanded to anyone who needs or wants to be tested. All of our county hospitals currently have capacity in both their regular beds and their intensive care unit beds, as well as ventilators. And happily, our cases are slowly and steadily decreasing. So that brings us to this week's update on our positivity graph. So as a reminder, on this graph, the gray bars are the number of tests that were done on that particular date. And then the colored lines are the running averages for both either a 7-day, which is the darker line, or a 14-day, which is the lighter of the similarly colored lines, average of cases by the date of test. So let me just show you a couple things. Or point out a couple things. The dark red line, which is the 7-day average of all of our cases, no matter where they came from, is now down to, as of May the 31st, down to 62.1. 62.1. To put that in perspective, a week ago, when I reported on cases through May the 24th, that same number was 80. So we are really making good progress, and I could not be happier about these numbers. The dark blue line, which represents all the cases from the community, including individuals at the Montgomery County Correctional Facility, it is now at 50.3. If we take out the individuals from the correctional facility, that is the dark blue dashed line, that is down to 49.1. And then finally, our long-term care facilities are represented by those sort of yellow-orange lines. The darker of those two lines, which I see as orange, but you might see as a dark yellow, is down to 11.9. So that just gives you a sense of the amount of progress that we've made in our long-term care facilities. So this is really great. This is the data to show how far we've come and the direction in which we're going. And if we just continue to do what we are doing, I am very comfortable that this county can open up safely and responsibly. But we still have virus in our midst, and we must each take personal responsibility for our actions. Any one of us could have the virus, have no symptoms, and be contagious. And so whenever you go out into the world, just think about that. Just imagine that that's you. Imagine that you have the virus, you don't know it, you don't have any symptoms, but maybe you're contagious. And so just please follow all the guidance. Follow the social distancing recommendations in the stores. Please stay at least 6 feet away from people. Cover your nose and mouth so that you would decrease the chance of spreading virus to somebody if you happen to have the virus and are contagious. Keep those hands clean. Try to keep them away from your face. Cover your cough, cover your sneeze. And just one final word about masks before I finish up today. As many of you know, was trained and practiced as an anesthesiologist for many, many years. And we always wore masks in the operating room, all day, every day. And we didn't wear masks to protect us from the patient. We wore masks to protect the patient from us. And that's what this wearing masks is all about. It is just a respectful and simple way to protect other people from you or me in case any of us happen to be positive, don't have any symptoms, and don't know it. So think about it that way. Think about it as just a way, one added step that you can take to help protect our community. And when you do have that mask on, please cover both your nose and your mouth. That is the most effective way to prevent any spread of virus. And with that, I am happy to take questions. I know Commissioner Lawrence is here. I do not believe Commissioner Gale is here. And we are both available for questions.
Thanks, Commissioner. We will start with Jim Melwert from KYW.
If Ken's here, can you give an update on the election and on counting?
I don't know if Lee is here or not. Is Lee here? Yeah, I haven't gotten a report on. I know counting continues. So counting continues. We're not done counting yet.
Okay. Is there any kind of ballpark estimate, guess, crystal ball on when that might wrap up?
I don't want to give that, so we can get back to you with that. I've been waiting to hear that, and I have not heard.
Okay. Significant gathering outside the courthouse yesterday, continuing protests in Philadelphia. Commissioner Arkush, what's your message to people taking part in those gatherings?
Yeah, I actually attended a gathering last night in Patterton. You know, this is a really challenging time in so many different ways for so many different people. And I think that each person should consider their own kind of risk benefit of attending a particular event. If you do go, I would urge you to wear a mask. I was very pleased that everybody had a mask on at the event I was at last night, and there were at least 500 or 600 people there. Keep in mind, it's hard when you're walking to keep that 6 feet distance, but do your best to do that. And I think everyone has to make their own personal kind of calculations on this. For me last night, I really did think for quite a bit about whether or not I should go. But I thought, as the leader of this county, it was important when invited to come stand with the community under the circumstances of this protest march, that is also part of my job, to be there when the community calls. And so I did attend, and will likely be at a couple of events this weekend as well. So we just have to be careful and be cautious and be responsible and be kind to one another. And hopefully these events can continue to be as peaceful and as safe as certainly the recent events have been here in Montgomery County.
Governor Wolf addressed this, acknowledging that it was kind of inconsistent on his part, but there has been criticism for him about potentially being a hypocrite for saying one thing and doing another. Do you worry that people will fire the same criticism at you? And if so, do you have a response to that?
I don't worry about it. I'm certain that there will be people who do. But the calculus that I made was that there are many people in our community, particularly Black and Brown people, who have been so drastically impacted by COVID-19. This disease has already laid bare inequities that we knew were present before COVID-19, and has certainly had a light shown on them because of COVID-19. We know that Black and Brown people have died in greater numbers, they've been infected in greater numbers, and in many cases it's because these are the individuals who we consider our essential workers, and they've been going to work, they've been riding public transportation. They have really put themselves out there in the midst of a very, very difficult situation. And so many of those individuals were already being deeply affected by this disease. And then, of course, on top of this is the senseless killing of Mr. George Floyd. So from where I sit, I have many roles as the chair of our county commission, and one of them has been to try to lead this county as safely as possible through this pandemic. But I also have a role to stand with our community when the community calls and when there is such a profound and deep need for coming together, for unity, and for healing in our community. So people can call me whatever they want, but I will always stand with people in our community when they ask me to stand with them. And I think that is as much a part of my job as anything else that I do every day.
Here's a question from Deanna Durrani, NBC 10. We have yet to dip below 50 cases per day. And if we are contact tracing nearly 50 cases a day, does this present a backlog or potential spread from the cases that are not traced in that day?
So great question. So remember, just today we were at 62 with our 7-day average. So we're getting really close. But our contact tracing is continuing to ramp up. So there was one of the first of our community partners that we've contacted with, I believe went online today. And then by the end of next week, we will have 3 more organizations online with us. So by the end of next week, we should be able to do 100 cases a day. And just one caveat about our current numbers, just a reminder that every day there is a number of those cases that are from long-term care facilities. And so the contact tracing for those is actually quite straightforward and relatively simple. You know, it typically just involves a phone call to the facility, and then the facilities are all keeping track of which staff has been working with which patient. And so it's very easy for us to get a list of names and reach out to the long-term care facilities is just informing those individuals themselves. So the ones that actually need that sort of full contact tracing, where they're looking for, you know, where do you work? What grocery stores were you in? You know, all those types of things. It's actually less than that total number because of the number that are from the long-term care facilities. So we're ready. And by next week, we'll be even more ready.
Thank you. There's no more questions.
Okay, Todd, that's it on your end?
If I could really quick, I kind of, yeah, I'm sorry. I missed or I was kind of in and out when you talked about the percentage of tests coming back positive.
Yes,
Is there, it sounded like it might be creeping up a bit, but it sounded like you're not concerned. Is that fair?
No, actually just the opposite. You might have heard me read a number from last week. So if we look at our 7-day average through May the 31st, which is the dark red line on that graph, which we will post on social media. As of May 31st, we were at 62.1. And last week when we presented the graph, we had data through May the 24th, and we were at 80. So we've come from 80 to 62.1.
Okay, thanks.
Got that? Okay, great.
Good.
Yeah, thank you for clarifying that. That's important. All right. So it sounds like that's everything. We are not going to do any press releases this weekend. So we will be back with a virtual briefing Monday at 3. So thanks, everybody. Have a good weekend and stay safe. Thank you, Rebecca.